So my name is Emma Taylor and I am a CAMHS mental health nurse and I'm the Children's Clinical Lead for Wysa. Some of the key challenges that children and mental health services are facing is that the issue of children's mental health has just become so huge. It's a pandemic in its own right, and the number of young people being referred far outstrips what we can provide in traditional services, and their world is ever growing but in an online space, and we have to be able to meet them there. So digital solutions are really important for adopting in the care pathway, not because that they can ever replace care, that's not what they're intended to do, but they can help augment the care pathway so they can increase capacity where there currently isn't any, they can improve access where there's currently limitations, and they can support young people where they're at, which is online in a world that is familiar to them. Services are using Wysa to support young people to access interventions that are clinically enabled at a really early stage of when they need them. We're looking at self-help, early intervention, supporting young people to access resources that are useful for them when they need them. They're also using it to help support young people that are sitting on really long waiting lists. And that integration with IAPTUS to allow clinicians to be able to view data is improving services' ability to understand how young people enter their service and what their journey looks like.